Hi everyone, and in this video I'll be discussing testosterone pharmacology. So we know that testosterone is a male hormone, so it will give rise to dihydrotestosterone, which is more efficacious. We have some weak androgens also, that is called epiandrostenedione and dehydroepiandrosterone. Now, why should we study testosterone? Because there are conditions where testosterone may not be synthesized. That may lead to delayed puberty, or after the puberty is achieved, the testosterone may not be secreted, leading to the loss of libido, loss of muscle mass. And you have heard of something called anabolic steroids. So, those steroids used for bodybuilding. So, what are those and what are the problems with them? We will understand all these things. Let us start with testosterone pharmacology and what we need to understand here. Right. So, I just want to tell you. So, we are dealing with the male sex hormone and two important ones. So it is called the testosterone. Testosterone will give rise to more efficacious, that is called dihydrotestosterone. And what is the enzyme which will convert that? The name is called 5-alpha reductase. Now these are the main androgens. So testosterone hormones are also called as androgens. We have certain weak androgens here. So they are not so much efficacious. The weak androgens. What are these weak androgens? They are called andro. So they are called as androstenedione. And one more is called dehydroepiandrosterone. Okay, you have studied them in physiology. And these androstenedione and dehydroepiandrosterone, these are mainly secreted from the adrenal gland. They are mainly released from adrenal gland, but they don't have so much of role. So main role is with the testosterone and dihydrotestosterone. Now let us understand certain physiology here. What is that? So the hypothalamus releases the releasing hormone, that is GnRH, and GnRH will act on the pituitary to activate FSH and LH. So what is the role of FSH? It is responsible for spermatogenesis. And what is the role of LH? Is testosterone synthesis. Testosterone synthesis. And we know that testosterone can produce negative feedback. If it is excess, it can produce negative feedback on pituitary as well as hypothalamus. Now, suppose we want to give testosterone. The problem with testosterone is if I give it orally, it has very high fast metabolism. So, the naturally occurring testosterone, the problem is if I take the pharmacokinetics, if we give this oral, it has high first pass metabolism, high first pass. So that's the reason it is not given orally. And even though if it is going inside, it has a very short half-life of 10 to 20 minutes. That's why I tell you repeatedly, the natural ones are usually shorter acting. So what we have to do, we cannot give the testosterone orally. So we came with the preparations. If I cannot give them orally and it is shorter acting, then we should give it in other routes. So we came with a preparation called T for testosterone enanthate. So it is called testosterone enanthate, and one more is called testosterone cypionate. Testosterone enanthate and testosterone cypionate. Now these are oily preparations. Oily preparation. So remember, when we are giving oily preparation, should we give it IV? Never. Oil should not be given IV because it may cause the fat embolism. So we have to give it intramuscular. Now when we give it intramuscular, it will stay there as a depot. So the drug will stay there and get slowly absorbed from them. So we give it as IM depot preparation and it is absorbed slowly, and that makes the drug longer acting. So what is the advantage of making it longer acting? Because somebody has testosterone deficiency, if I tell them to take everyday injection, so it's very unlikely the patient follow that. So if I give injections and they act for weeks, it's easy to give to the patient. Then we have come across one more preparation of testosterone. It is called testosterone undecanoate. It is called testosterone undecanoate. Now this can be given oral as well as IM. Sir, just now you told you cannot give it oral. Now this has an advantage. Now I told you these are oily preparations. This deconate, when you give orally, it is absorbed through lymphatics. Absorbed through lymphatics. So that is the advantage. So you can give it orally, but the absorption is by lymphatics. Very, very important. Then later what we did is we started changing the structure of this testosterone to make them more anabolic. Anabolic means bodybuilding. Now these are called as 17 alpha alkylated testosterones. 17 alpha alkylated testosterone. Right, sir. Now what are these testosterones? You know testosterone, for that you add methyl, it becomes methyl testosterone. Then you have a drug called stana, so it is called stanozolol. So don't confuse as beta blocker. One exception is stanozolol. It's not a beta blocker. Remember, it's a testosterone preparation. Then danazol. Then we have oxandrolone. It is called oxandrolone. It is called as oxandrolone. Then we have fluoxymestrone. Fluoxymesterone. So these are 17 alpha alkylated testosterones. Okay, sir. So methyl testosterone, stanozol, danazol, oxandrolone, fluoxymestrone. You can remember by the mnemonic me. So I am me, Stan and Dan. So me, Stan and Dan have ox and fluox. So what is that? Me for methyl testosterone, Stan for stanozol, Dan for danazol, then ox for oxandrolone, fluox means fluoxymestrone. Okay, sir, fine. But what are the specialties of this? Now, when you make them 17 alpha alkylated testosterone, they have become more anabolic. More anabolic. The meaning is they are more going to increase the muscle mass. And you can give them orally, they have less first pass. They have less first pass metabolism. So you can give them orally also. And third, they are less androgenic. So what do you mean by less androgenic? You know, testosterone is going to increase the growth of mustache, then it is going to increase the prostate size. So those things are not going to increase much, but muscle mass is going to increase. That is the meaning of more anabolic. Sir, why people should not take this and build a body is a question. The reason is if it is used, they cause lipid abnormality. Lipid abnormality. So what is the lipid abnormality, sir? So what do? They increase the LDL and decrease the HDL. So you know what is the problem? If you increase the LDL and decrease the HDL, the problem is the chance of atherosclerosis plaque is more. So there is atherosclerosis is seen, and there is a chance of patient being dying with MI or stroke. So that's the reason why these are to be used very carefully. But many a times what is happening in the present world, without any consultation with the doctors. They are using it, and many are building the body and they are dying with this MI. So there are certain drugs which are used as anabolic steroids. I'll tell you what is the meaning of anabolic steroid and how do we decide that it's anabolic steroid. So anabolic steroids. Okay, so unless I tell you anabolic steroid, don't confuse steroids with other things. Steroids, usually when we talk in medical terms, it is a corticosteroid, glucocorticoid, mineralocorticoid. So only when we tell anabolic steroid, they are the one which are used for bodybuilding. Now, how do I know and how did the scientists come to the conclusion they are going to increase the body? That is, they are going to increase the muscle mass. They have higher anabolic activity. So anabolic activity is more than androgenic activity. So this is what we mean by anabolic steroids. Now what they did is they did an experiment with a rat. So they took the rat. What they did is for the rat, they castrated the rat. What happens if you castrate the rat? Obviously, the testosterone is not synthesized. So for that, what they gave these drugs. So if it is castrated, no testosterone. Now when there is no testosterone, then when we give these preparations, then we want to check what happens. What we check? We want to check the levator ani muscle of the animal, and we also want to check the prostate of the animal. So if the new drug, which is called a testosterone preparation, if they have equal activity on the muscle as well as prostate, they don't have much activity. But if the ratio increases more and more, that means the ratio becomes 2 or 3, that means it is going to build a muscle more. So we weigh the muscle and levator ani muscle, we weigh the prostate. So if it is more towards the muscle, then the experiment tells that it is more anabolic in nature. It is more anabolic in nature. So what are the anabolic androgens? I'll just give an example for them. Examples what are used in bodybuilding are nandrolone, then oxymetholone, and one more is stanozolol. So these are anabolic steroids which are used. Okay. So once I understand the concept, it's important that we understand the uses of testosterone. Where to use it? So let me tell you the uses of testosterone. Testosterone uses. It is nothing but the extension of the physiology what you already know. Now testosterone is used in testicular failure. So when the testes will not produce the testosterone, we call it as testicular failure. Now there are two types of failure, the primary failure and the secondary failure. Sir, what do you mean by the primary failure? Primary means in the childhood only the testosterone is not secreted by testes. So what happens if it is not secreted? The male child will not achieve the puberty. So there will be delayed puberty. Now what is secondary, sir? Secondary means he achieved the puberty, but later in the life, testosterone is not secreted from the testes. So that will lead to the loss of libido in the male, and they may lose the mass, muscle mass, loss of muscle mass. Then also you can give testosterone preparation. Correct. Another use of this is when there is hypopituitarism. So hypopituitarism. So pituitary is not working properly. Or we can also use it in one more case that is called primary hypogonadism. Primary hypogonadism. We can use it. Okay, so these are all replacement uses where the testosterone is not there, we can replace it. But what are the other uses of this? What are the other uses of this testosterone? Let me tell you. Now, since testosterone increases spermatogenesis, so which condition we can use it in the management of infertility? Suppose a person is having oligospermia and his androgen levels are less, then give testosterone. Now, where do you use anabolic steroid? Where do you want to build muscles? Now, the question is asked, how come even in our natural we have testosterone, the body will not be built so fast? Now, what happens when we give anabolic steroid and what happens normally? Normally, when a person does the exercise, what happens? The muscles will tear and get repaired. Tear and repair. So when they tear and repair, they lengthen. They lengthen. The muscle will lengthen up. So the tear and repair takes longer time when you do the exercise normally. But when you give anabolic steroid, the tear and repair takes shorter time. So that's why the muscle length increases, and that's why you can see the huge bodies in bodybuilders, those who are abusing this. So anabolic steroids are used therapeutically also. Suppose there is severe muscle wasting. So if there is muscle wasting, sir, where do you find this muscle wasting in our medical due to certain chronic illnesses? So chronic illness may have done that, or another condition, HIV or a cancer may have done the muscle wasting. Second important is osteoporosis. Nowadays we have better drug for osteoporosis. It is not used. So there is one use, osteoporosis, but we have better drugs than this. And it is a drug used in sports also to increase physical activity. Physical activity in sports. And another important is it is used to correct anemia. So anemia, which anemia? Which is associated with malignancy. Anemia associated with malignancy. Hemolysis. And also anemia due to chronic illness. So there we can use them. Okay. So this is about, now for osteoporosis anemias we have better drug. So these are all older users, but still certain resistant cases we can use them. Sir, what about the 17 alpha alkylated ones? 17 alpha alkylated testosterones. Now this one has shown to increase the C1 esterase levels. C1 esterase levels. So what is the condition where C1 esterase is deficient? The condition is they are used to treat a condition, what is it called? Hereditary angioneurotic edema. So hereditary angioneurotic edema is a condition where C1 esterase is deficient. When that is deficient, the complementary pathway gets activated, patient will develop this problem, hereditary angioneurotic edema. So why do you give them? Because these steroids increase the activity of C1 esterase. So commonly used are danazolol, and so it is called danazolol, and one more is so stanozolol and danazol. So these are the two drugs which are commonly used in practice for hereditary angioedema edema. One is stanozolol and danazol, right? So these are the uses of testosterone. Yes. So once we understand the uses of testosterone, we need to understand any adverse effect if we give testosterone. Yes. Can you guess? Yes. Let us understand. Let us understand in a similar fashion. Testosterone. Adverse effects. What are the adverse effects of testosterone? Now, the point here is, can we give testosterone in a female? What happens if I give testosterone in a female if she takes it? Now, the female will have virilizing side effect. virilization. That means she will develop the male voice, she develops the mustache, beard, she will have the male appearance, and that will also increase masculinity in females. So this is why we should not use it in females. Yes. Now the next important thing is, can we use it in child? Can we use it in children? What is the problem if I use it in children? In children, if you use testosterone, it may lead to premature closure of epiphysis. Premature closure of epiphysis can happen. Yes. So what happens if epiphysis is closed too early? They will not achieve the height, so there will be stunted growth. So there will be stunted growth. Yes. Now what happens if testosterone is given in a child? Again, the puberty is early. That is called precocious puberty. Precocious puberty may happen. Now what happens if you give it in an adult, high dose? Not normally. I am talking about high dose in adult. Adult, if I give high dose. Yes. Now if I give this in high dose in adult, you know that testosterone causes negative feedback mechanism. So it will act on the pituitary and decrease FSH. Now what happens if you decrease FSH activity? The spermatogenesis will not happen, and that will lead to the adverse effect, that is oligospermia. So obviously if the patient sperm count is decreased, he will have infertility. And I'm not talking about low dose or normal dose, it is higher dose. Now the patient may also develop gynecomastia. Sir, how come testosterone can cause gynecomastia? Now testosterone, which is given high, may become estradiol in the male, and that is going to influence on the breast tissues. So patient may develop this at higher dose, and they can also increase the risk of acne. Okay, sir, what about the anabolic steroids? So I told you anabolic steroids are 17 alpha alkylated ones. So if we are using this in the patient, what is the problem? There are two problems what we can face with them. Number one, the liver problem, that is cholestatic jaundice. So patient may develop cholestatic jaundice, that is one problem. So one more rare problem is, it is called pileosis hepatica. It is called pileosis hepatica, and it can produce dyslipidemia. I told you they can increase LDL, decrease HDL, so this may lead to the risk of MI. So this is what the problem with testosterone, and we have learned the importance of testosterone. So uses, adverse effect, then what is the meaning of anabolic steroid, and how do you know it is anabolic, and what is 17 alpha alkylated testosterone, and we started from here. So that is about the testosterone pharmacology. Thank you all.